Dear audience, Assalamu alaikum. I am Professor Shamsud-Jaman, Professor of Pathology. I welcome all in today's 6th lecture on hematology. Today's topic is leukemia. Now come to leukemia, day 1 of leukemia lecture. First come to what is leukemia. Neoplastic proliferation of hematopoietic stem cell. So, neoplastic proliferation of hematopoietic stem cell with appearance of immature cell in peripheral blood with or without. So, neoplastic proliferation of hematopoietic stem cell with appearance of immature cell are formed in peripheral blood with or without infiltration in other organ or tissue is called leukemia. So, neoplastic proliferation of hematopoietic stem cell with appearance of immature cell in peripheral blood with or without infiltration in other organ or tissue is called leukemia. Dear audience, this is the medullary cavity and this is the bone and this is the blood. By definition, the bone marrow contains hematopoietic stem cell in bone marrow. So, this is the cancer or this is the neoplasm of the hematopoietic stem cell in the bone marrow. So, this is the cancer of hematopoietic stem cell of the bone marrow. So, stem cell here, stem cell. So, this is stem cell cancer. So, neoplastic proliferation of this stem cell and with appearance of immature form, and from the bone immature cell comes in blood. And this immature cell that comes from bone marrow in blood or that remains within the bone marrow, these are called leukemic cell. So, we will get leukemic cell in peripheral blood, and this leukemic cell may infiltrate or may not infiltrate other organ or tissue. So, it is the cancer of the hematopoietic stem cell in bone marrow. Due to cancer, immature cell comes in blood, and these immature cell or these leukemic cell may infiltrate other organ or tissue. Either it infiltrate or it does not infiltrate. It is called leukemia by definition. Now come to, if organ or tissue is infiltrated by leukemic cell, what are the organs may be infiltrated? Organs may be infiltrated. Organs may be infiltrated by leukemic cell in leukemia. What are the organs? The organs may be lymph node, organ may be spleen, organ may be liver. Dear audience, you know, in our normal physiological condition, there is RBC, WBC and platelet as the formed elements of blood, and in normal individual there is no immature form of RBC, there is no immature form of WC in the blood. So we can say normally in our blood there is no immature cell, there is no blast cell, there is no immature cell. But in leukemia there is immature cell in the peripheral blood. Now come to how many percentages of immature cell or leukemic cell is required in the peripheral blood or in the bone marrow to declare it is a case of leukemia. So percentages of immature cells. So percentage of immature cell in bone marrow or in blood in leukemia. The percentage of immature cell in the bone marrow or in the blood, it should be more than 15%. If more than 15% immature cells in found in bone marrow or in the blood, it is called leukemia. Dear audience, now come to how can we classify leukemia. Now come to classification of leukemia. Leukemia may be classified as based on clinical course and prognosis. Then it can be classified based on cell lineage involved, based on cell lineage involvement, based on cell lineage involvement. And another classification, French, American and British classification, FAB classification, French, America, British classification of acute leukemia. So we can classify leukemia based on clinical course and prognosis, based on cell lineage involvement, and lastly French, America, British classification of acute leukemia. First come to based on clinical course and prognosis. Based on clinical course and prognosis. It may be acute leukemia. It may be acute leukemia. In acute leukemia, the clinical course is short and prognosis is worse. So short clinical course and worse prognosis. Then chronic leukemia. Chronic leukemia, the clinical course is long and prognosis is better. Long clinical course and better prognosis. So this is on the basis of clinical course and prognosis. Now come to based on cell lineage involvement. Based on cell lineage involvement. It may be myeloid leukemia. myeloid leukemia. Myeloid leukemia is two types. One is acute myeloid leukemia, or it is called acute myeloblastic leukemia. Acute myeloblastic leukemia. An abbreviation of acute myeloblastic leukemia or acute myeloid leukemia, AML. AML. Another is chronic myeloid leukemia. Chronic myeloid leukemia. And it is also called chronic granulocytic leukemia. Chronic granulocytic leukemia, briefly or abbreviation CML, or it is also called chronic granulocytic leukemia. Chronic granulocytic leukemia, CGL. Now come to, this is myeloid leukemia, another is lymphoid leukemia. So on the basis of cell lineage involvement, one is myeloid leukemia, another is lymphoid leukemia. Lymphoid leukemia. Lymphoid leukemia is two types. One is acute lymphoid leukemia, or it is called acute lymphoblastic leukemia. Acute lymphoblastic leukemia. Abbreviation is ALL. Acute lymphoblastic leukemia. Another is chronic lymphoid leukemia or chronic lymphocytic leukemia. So another is chronic lymphoid leukemia or chronic lymphocytic leukemia. It is abbreviated as CLL. So these are the on the basis of cell lineage involvement. Now come to FAB classification, France America British classification of acute leukemia. FAB classification. Dear audience, one thing is important. I have told you, if it is bone marrow, this is the bone medullary cavity containing the hemopoietic stem cell. Hemopoietic stem cell. Leukemia is the cancer of hemopoietic stem cell, and you know from the hemopoietic stem cell we get RBC, we get WBC, we get platelet. So we get RBC, WBC, platelet from the hemopoietic stem cell. If there is cancer of hemopoietic stem cell, cancer should be cancer or leukemia should be leukemia of RBC series, leukemia of WBC series, and leukemia of platelet also. As RBC, WBC, platelet all are derived from the hemopoietic stem cell, as leukemia is nothing but the cancer of hemopoietic stem cell, so there should have leukemia of RBC, leukemia of WBC, leukemia of platelet. But up to this classification, we got leukemia of lymphoid series, leukemia of myeloid series, but no leukemia of RBC, no leukemia of platelet up to this classification. So if we go through the FAB classification, we can get leukemia of RBC and leukemia of platelet also. Now come to FAB classification. It is broadly two types: acute myeloblastic leukemia, acute myeloblastic leukemia, and another is acute lymphoblastic leukemia. Leucoblastic leukemia. So broadly acute myeloblastic leukemia and acute lymphoblastic leukemia. Now come to acute myeloblastic leukemia. Acute myeloblastic leukemia. Dear audience, acute myeloblastic leukemia in FEB classification is divided as seven types. Number one is called M1 acute myeloblastic leukemia. It is called acute myeloblastic leukemia without maturation. Acute myeloblastic leukemia without maturation. What it means? In this type of M1 acute myeloblastic leukemia without maturation, the blast cells that you got, a least number or a few number of blast cells are myeloperoxidase positive, and most of the blast cells are not myeloperoxidase positive. So a few number blast cells are myeloperoxidase positive. In case of M1, it is called acute myeloblastic leukemia without maturation. Now come to M2. M2, it is called acute myeloblastic leukemia with maturation. So it is acute myeloblastic leukemia with maturation. What it says, in this type, majority of blast cells or majority of immature blast cells are myeloperoxidase positive. Dear audience, one thing is important. We know there is lymphoblast in case of lymphoblastic leukemia, there is myeloblast in case of myeloblastic leukemia. We can differentiate or we can identify a myeloblast or a lymphoblast under microscope after staining. And there is another tool to identify the myeloblast and lymphoblast, or to differentiate myeloblast from lymphoblast. The tool is myeloperoxidase test. If we put here myeloperoxidase and if we put here myeloblast and lymphoblast, the myeloblast will be peroxidase positive and lymphoblast is not peroxidase positive. So myeloblast is peroxidase positive, lymphoblast is peroxidase negative. So if we do myeloperoxidase test in case of acute myeloblastic leukemia without maturation, a few of the blast cells become myeloperoxidase positive. So it is called without maturation. But in case of M2, most of the cells are myeloperoxidase positive. So it is called acute myeloblastic leukemia with maturation. M3, from hypergranular, it is hypergranular promyelocytic leukemia. So hypergranular promyelocytic leukemia. In this type, dear audience, I have told you in case of leukemia there is immature cell in peripheral blood. If most of the cells of immature cell in peripheral blood is promyelocyte, then it is called promyelocytic leukemia. Suppose you have got 30% immature cell in peripheral blood, 30% immature cell. If out of 30% immature cell, most of the cells are promyelocyte, then it is called promyelocytic leukemia. So in this type, the cells are promyelocyte. In this type, most of the cells are promyelocyte and myeloperoxidase positive. So in M3, it is called hypergranular promyelocytic leukemia. In this type, most of the immature cells are promyelocyte and the cells are myeloperoxidase positive. Now come to M4. It is called myelomonocytic leukemia. Myelomonocytic leukemia. Dear audience, in this type, immature form of cells of both myeloid and monocyte lineage cell found. What I tell, in this type, immature cells of both myeloid and monocytic lineage cell found. So in this type, the immature cell that we get, there is immature form of myeloid series and immature form of monocytic series. This is called myelomonocytic leukemia. Now come to M5. This is called monocytic leukemia. M5 is monocytic leukemia. It is two types. One is M5A. In this type, we get blast cells. M5 means monocytic leukemia. Without maturation. What it means? It is definitely monocytic leukemia, acute monocytic leukemia. The blast cell that we found in M5A, most of the cells are undifferentiated. What else? Here a list number cells are differentiated. So these are the blast cells of monocytic series, but a few number of cells are differentiated as monoblast. Then M5B. M5B, it is called monocytic leukemia. Monocytic leukemia with maturation or with differentiation. Monocytic leukemia with maturation or with differentiation. So monocytic leukemia with differentiation or with maturation. In this type, most of the cells are differentiated. As monoblast. as monoblast. So in monocytic leukemia with differentiation, most of the cells are differentiated as monoblast. In addition, there is promonocyte and monocyte found. So dear audience, how can we differentiate M5A and M5B? M5A is monocytic leukemia without differentiation. Here a few number of cells are differentiated as monoblast, and there is no promonocyte and monocyte cell along with it. But in case of M5B, it is called monocytic leukemia with differentiation. In this type, most of the cells are differentiated as monoblast. In addition to this, there is promonocyte and monocyte. Then M6, it is called erythroleukemia. That is, it is the leukemia of RBC series. Erythroleukemia, that is leukemia of RBC series. In this type, what we'll get? In this type, we get more than 50% nucleated cells of bone marrow are erythroblast. Erythroblast means these are the nucleated red cell, and this is the initial stage of erythropoiesis. Dear audience, in bone marrow, if we consider bone marrow in the bone marrow, you know there is nucleated cells of WBC series, nucleated cells of RBC series in the bone marrow. If more than 50% of the nucleated cells in the bone marrow are erythroblast, then it is a case of erythroleukemia. It is a cancer, blood cancer of RBC series. In addition to this, in blood, more than 50% nucleated cells in bone marrow as erythroblast. In addition to this, in blood, numerous number nucleated red cells. So we don't get any nucleated cell in blood, but in erythroleukemia, numerous number nucleated cells is found, and there is more than 50% nucleated red cells of bone marrow are erythroblast in case of erythroleukemia. Now come to M7. It is called megakaryoblast leukemia. Dear audience, you know from the megakaryocyte comes, and from the megakaryocytes we get platelet from the bone marrow. So this is the FAB classification, where you get leukemia of RBC, leukemia of megakaryocyte. So this is all about the acute myeloblastic leukemia. Dear audience, one thing is important. In this type from M1 to M7, there is leukemia of WBC series, leukemia of monocyte, leukemia of megakaryoblast, leukemia of RBC series. All are under the heading of acute myeloblastic leukemia. So we can say it as acute non-lymphoblastic leukemia. If we call it acute non-lymphoblastic leukemia instead of acute myeloblastic leukemia, then M1 to M7 is fitted here. Now come to acute lymphoblastic leukemia. In FAB classification, this is all about the acute myeloblastic leukemia. Now come to acute lymphoblastic leukemia in FAB classification. Acute lymphoblastic leukemia. FAB classification. In FAB classification, acute lymphoblastic leukemia is classified as three. Number 1, L1 acute lymphoblastic leukemia. Here in this type, or it is homogeneous. It is homogeneous, a small lymphoblastic leukemia. Lymphoblastic leukemia. Dear audience, we know there is a small lymphocyte and large lymphocyte. So there is a small lymphoblast and large lymphoblast. The acute lymphoblastic leukemia, where most of the cells are small lymphoblast, it is called homogeneous, a small lymphoblastic leukemia. That is L1. Now come to L3. L3, it is homogeneous. It is also homogeneous. Homogeneous large lymphoblastic leukemia. It is homogeneous large lymphoblastic leukemia. So in this L3 type, we get most of the lymphoblast are large lymphoblast. Now come to M2. It is heterogeneous. Why it is heterogeneous? In this L2 type acute lymphoblastic leukemia, we get both small lymphoblastic and large lymphoblastic cells. So both small and large lymphoblast. So it is called heterogeneous. So this is all about the FAB classification. Now come to what are the differences between acute myeloblastic leukemia and acute lymphoblastic leukemia. I have told you here in FAB classification, acute myeloblastic leukemia, and we can say it acute non-lymphoblastic leukemia. Another is acute lymphoblastic leukemia. So how can we differentiate between acute myeloblastic leukemia and acute lymphoblastic leukemia? Now come to differences between acute lymphoblastic leukemia and acute myeloblastic leukemia. First come to age of occurrence. Age of occurrence. Both acute lymphoblastic and myeloblastic leukemia usually occurs in childhood, but acute lymphoblastic leukemia usually under 5 years. Usually under 5 years of age common, but AML, acute myeloblast leukemia, usually after 5 years of age common. Then lymphadenopathy. Dear audience, I have told you leukemic cell may infiltrate in bone marrow, lymph node, spleen, liver. So due to infiltration in the lymph node, there is lymphadenopathy. This lymphadenopathy is common in acute lymphoblastic leukemia and common in acute myeloblastic leukemia. So it is uncommon in acute myeloblastic leukemia. Number 3, splenomegaly. Splenomegaly is uncommon in acute lymphoblastic leukemia and common in acute myeloblastic leukemia. Then hepatomegaly. Hepatomegaly is uncommon in acute lymphoblastic leukemia and common is acute myeloblastic leukemia. Common in acute myeloblastic leukemia. Then come to skin infiltration. Skin infiltration is common in acute lymphoblastic leukemia. Here is common. Uncommon in acute myeloblastic leukemia. Then gum hypertrophy. The gum hypertrophy is common in ALL. It is common in acute lymphoblastic leukemia, and it is uncommon in acute myeloblastic leukemia. Then the immature cells in peripheral blood or in the bone marrow, immature cells. In case of acute lymphoblastic leukemia, the immature cells are lymphoblast. Immature cells are lymphoblast. But in case of acute myeloblastic leukemia, the immature cells are myeloblast. So dear audience, these are the differences between acute lymphoblastic leukemia and acute myeloblastic leukemia. Now come to how can we differentiate or how can we identify a lymphoblast and a myeloblast. Dear audience, we know in case of acute lymphoblastic leukemia, the predominating cells are the lymphoblast, and in case of acute myeloblastic leukemia, the predominating cells are the myeloblast. So we have to differentiate a lymphoblast from myeloblast. Now come to differences between myeloblast and lymphoblast. First come to size. Size of cell. Dear audience, you know, in case of cancer or the cancer cells or malignant cells are always increased in size and larger in size. So leukemic cell that we get in leukemia, this is the cancer cell, it is larger size. Both myeloblast and lymphoblast are larger in size, but in comparison, myeloblast is a bit larger than the lymphoblast. So size of lymphoblast is larger than lymphoblast, and lymphoblast is a smaller size than myeloblast, but both are large. Then nucleus of myeloblast, large and indented. But in case of lymphoblast, nucleus is large and round. So if you consider, this is a large cell myeloblast and this is a large cell lymphoblast but smaller than myeloblast. There is large and round nucleus like this, but in case of myeloblast, the nucleus is a bit indented like this. So this is the nucleus of myeloblast, like this, indented nucleus. Then number 3, cytoplasmic granules. Cytoplasmic granules may be found in myeloblast, may be found in myeloblast. So in case of myeloblast, we can get cytoplasmic granules, but it is always absent in lymphoblast. Then ore body may be present in myeloblast. But it is absent in lymphoblast. Now come to, these are the granules, like the ore bodies like this, It is present in, may be present in myeloblast but absent in lymphoblast. Number 5, number of nucleolus. Number of nucleolus in case of lymphoblast, number of nucleolus is 1 to 2. So in case of lymphoblast, number is 1 to 2 in number in case of lymphoblast. But in case of myeloblast, the number of nucleolus is 2 to 5 in number in case of myeloblast. So 2 to 5 in number. So number of nucleolus in case of myeloblast more than the lymphoblast. In case of myeloblast 2 to 5, but in case of lymphoblast 1 to 2. So these are the differences between myeloblast and lymphoblast that we can see under a microscope. If we fail to differentiate under a microscope, then we have to do myeloperoxidase test to differentiate these two blast cells. Then myeloperoxidase test. Myeloperoxidase test. Why you do this test? To differentiate a myeloblast from lymphoblast when you fail to differentiate under a microscope, or to become more sure. So myeloperoxidase test is myeloblast is positive in myeloperoxidase test. So myeloblast is myeloperoxidase positive. Myeloperoxidase positive. So myeloblast is myeloperoxidase positive, a lymphoblast is myeloperoxidase negative. Myeloperoxidase negative. So these are the differences between myeloblast and lymphoblast. Dear friends, I have told you in this day 1 lecture on leukemia, definition of leukemia, classification of leukemia, based on clinical course and prognosis, based on cell lineage involvement, FEB classification, French, American, British classification. Then I have told you the differences between acute myeloblast leukemia and acute lymphoblast leukemia. Then I have told you what are the differences between myeloblast and lymphoblast. Again, I have told you more than 50% invasive cell is needed to declare a case of leukemia. Today up to this, thanks all.